Have you ever sat by an elderly loved one and noticed small, almost unnoticeable changes? Perhaps they've become quieter, their steps slower, or their appetite just isn't what it used to be. At first, these changes seem like a normal part of aging, something we brush off and tell ourselves, they're just getting older. But what if I told you these small shifts are often the body's way of sending quiet warnings? The truth is, death in old age rarely comes without signals. The body starts whispering months, even years in advance, but most people miss these signs. Why? Because they're so subtle. They seem harmless. Only later, when families look back, do they realize how those whispers were trying to prepare them. In this video, as someone who has lived through the challenges of aging, I want to share 5 subtle warnings you mustn't ignore. These signs aren't just clues to a loved one's health. They're opportunities to act, to show love, and to make their final year filled with care, comfort, and meaning. Don't wait until it's too late to recognize them. First sign, unexplained weight loss. Losing weight without trying might seem like a good thing at first. After all, many people struggle with their weight throughout their lives. But when the pounds start coming off and you haven't changed your diet or activity level, it's time to pay attention. For people over the age of 65, unexplained weight loss is not something to brush off. It can be a sign that something serious is going on inside your body. Understanding why this happens, what it could mean, and what steps to take can make all the difference. Weight loss happens when your body uses more calories than it takes in. This is normal if you're dieting or exercising, but when you're eating the same and not moving any more than usual, it's a signal that something could be wrong. Sometimes the body starts breaking down fat and muscle because it's struggling to keep up with an illness or because something is interfering with how it processes food. In older adults, this can happen more easily because the body naturally loses muscle and strength with age. But when weight loss is sudden and unexplained, it could point to something more serious. One of the most common causes of unintentional weight loss is a chronic illness. Conditions like cancer, diabetes, or thyroid problems often have weight loss as one of their first symptoms. For example, certain types of cancer, such as those in the stomach or pancreas, can make it hard to digest food properly or cause you to lose your appetite altogether. Even if you're eating, the body might not be absorbing nutrients as it should. Similarly, an overactive thyroid speeds up your metabolism, causing you to burn through calories at a faster rate than normal. Diabetes, especially when it's not well controlled, can lead to weight loss because the body starts using fat and muscle for energy instead of sugar from your bloodstream. Heart and lung conditions can also contribute to weight loss. When the heart or lungs are not functioning well, it can leave you feeling fatigued and less interested in eating. Chronic obstructive pulmonary disease, COPD, for example, makes it harder to breathe, and the extra effort your body puts into simply getting oxygen can cause you to burn more calories. People with heart failure often experience fluid buildup and swelling, which can mask weight loss at first. But as the condition worsens, the body may start breaking down muscle for energy. Mental health plays a big role in weight loss as well. Depression is a common issue among older adults and often goes unnoticed. When you're feeling down, you might lose interest in food or forget to eat altogether. For some, food loses its taste or appeal, making it easy to skip meals. Depression can also lead to changes in sleep patterns and energy levels, which can further contribute to weight loss. Similarly, dementia can affect eating habits. People with Alzheimer's or other forms of dementia might forget to eat, lose their appetite, or have difficulty swallowing, all of which can result in significant weight loss. Medications and medical treatments can also cause unintentional weight loss. Some medications have side effects like nausea, dry mouth, or changes in taste, which can make eating unpleasant. Treatments like chemotherapy or radiation often reduce appetite or make certain foods taste metallic or bitter. If you're taking several medications, they might interact in ways that affect your digestion or metabolism, further contributing to weight loss. Digestive issues are another major cause of unexplained weight loss. Conditions like ulcers, irritable bowel syndrome, IBS, or celiac disease can make it hard for your body to absorb the nutrients it needs. This means that even if you're eating enough, your body isn't getting the energy it requires to function properly. Infections in the stomach or intestines can also cause weight loss by interfering with digestion or causing symptoms like diarrhea and nausea that make eating difficult. While unexplained weight loss can be caused by a variety of factors, it's important to understand the risks it poses, especially for older adults. When you lose weight, you're not just losing fat, you're also losing muscle. This can lead to a condition called sarcopenia, which makes it harder to walk, climb stairs, or even stand up from a chair. Muscle loss increases the risk of falls, which can be particularly dangerous for older adults. Falls often lead to broken bones, lengthy hospital stays, and a decline in overall health. Another risk of weight loss is a weakened immune system. Your body needs proper nutrition to fight off infections, and when you're not getting enough calories or nutrients, your immune system becomes less effective. This makes it harder to recover from illnesses like the flu or pneumonia, which can be life-threatening for older adults. Weight loss can also lead to nutritional deficiencies, such as low levels of iron, calcium, or vitamin D. These deficiencies can cause problems like anemia, weak bones, or vision issues. Fatigue is another common outcome of weight loss. Without enough calories, your body doesn't have the energy it needs to carry out daily activities. This can leave you feeling tired, weak, and less interested in doing the things you enjoy. Over time, this lack of energy can lead to a decline in physical and mental health, making it harder to maintain independence. So, what should you do if you notice unexplained weight loss in yourself or a loved one? The first step is to visit a doctor. They can help figure out what's causing the weight loss by asking about your eating habits, medical history, and other symptoms. They might also order tests, like blood work or imaging scans, to look for underlying conditions. It's important to provide as much information as possible, including any recent changes in medications, appetite, or physical activity. Keeping a food diary can also be helpful. Writing down what you eat and drink over the course of a week can give your doctor a better idea of your eating habits and whether you're getting enough calories and nutrients. If you're having trouble eating, try smaller, more frequent meals instead of 3 large ones. Foods that are easy to digest, like soups, smoothies, or protein shakes, can help you get the nutrients you need without feeling too full. In some cases, you might need extra support, such as working with a dietitian to create a meal plan or taking supplements to address nutritional deficiencies. If depression or another mental health issue is contributing to weight loss, therapy or medication might be necessary. It's also a good idea to involve family members or caregivers who can help with meal preparation, grocery shopping, or simply providing company during meals. Preventing weight loss is always better than trying to fix it after it happens. Eating a balanced diet, staying active, and visiting your doctor regularly can all help you maintain a healthy weight as you age. If you notice any changes in your weight, appetite, or energy levels, don't wait to seek help. Remember, unexplained weight loss is your body's way of saying that something isn't right. If you found this information helpful so far, make sure to like this video. Your support helps us reach more people who might need these life-saving insights. Let's spread the word together. Just one click can make a difference. Second warning sign is fatigue. Everyone feels tired from time to time. Maybe you didn't sleep well or you've had a long day. But what happens when that tiredness doesn't go away? When even the simplest tasks, like walking to the kitchen or getting dressed, feel like climbing a mountain? This kind of persistent, overwhelming fatigue is not normal, especially for older adults. It's a sign that your body is struggling with something bigger, and understanding the reasons behind it can help you take the right steps to feel better. Fatigue is not just about feeling sleepy. It's a deep, bone-weary exhaustion that doesn't go away with rest. It can affect your physical energy, your ability to concentrate, and even your emotional well-being. For people over 65, fatigue is particularly concerning because it often points to an underlying health issue. Your body might be working overtime to fight off an illness, cope with stress, or deal with nutritional imbalances, and that's why you're feeling drained. One of the most common causes of fatigue is anemia. This condition occurs when your body doesn't have enough red blood cells to carry oxygen to your tissues. Without enough oxygen, your muscles and organs don't function properly, leaving you feeling weak and tired. Anemia can be caused by many things, such as blood loss, poor nutrition, or chronic illnesses like kidney disease. For older adults, anemia often develops slowly, making it hard to notice at first. But if you're constantly fatigued, it's worth getting your blood levels checked. Heart problems are another major cause of fatigue. Conditions like heart failure make it harder for your heart to pump blood efficiently. When your muscles and organs don't get enough blood, they don't get the oxygen and nutrients they need, and you end up feeling exhausted. Fatigue from heart issues is often accompanied by other symptoms like shortness of breath, swollen feet, or chest discomfort. If you notice these signs, it's important to see a doctor right away, as untreated heart problems can quickly become life-threatening. Lung conditions like chronic obstructive pulmonary disease, COPD, or asthma can also cause fatigue. When your lungs aren't working properly, your body has to work harder to get the oxygen it needs. This extra effort can leave you feeling worn out, even after simple activities like walking or talking. Sleep apnea, a condition where your breathing stops and starts during sleep, is another common culprit. People with sleep apnea often feel tired during the day because their bodies don't get the deep, restful sleep they need. Fatigue can also be a sign of an underactive thyroid, a condition known as hypothyroidism. The thyroid is a small gland in your neck that controls your metabolism, or how your body uses energy. When it's not producing enough hormones, everything in your body slows down. You might feel tired, cold, or depressed, and you might notice other symptoms like weight gain or dry skin. Hypothyroidism is common in older adults, especially women, but it can be easily treated with medication once diagnosed. Chronic infections and inflammation can sap your energy as well. Conditions like rheumatoid arthritis, lupus, or even a lingering infection can cause your immune system to stay active for long periods. This constant state of alert drains your body's resources, leaving you feeling fatigued. Cancer, too, is often accompanied by fatigue. The disease itself, as well as treatments like chemotherapy, can make you feel exhausted because they take a toll on your body's energy reserves. Mental health is another key factor. Depression and anxiety don't just affect your mood, they also affect your energy levels. When you're feeling down or worried, it's hard to get out of bed, let alone tackle your daily responsibilities. For older adults, loneliness and isolation can make these feelings worse, creating a cycle of fatigue and inactivity. Cognitive issues like dementia can also lead to fatigue, as they put extra strain on the brain, making even simple decisions feel exhausting. Lifestyle factors shouldn't be overlooked either. Poor diet, dehydration, and lack of physical activity can all contribute to fatigue. If you're not eating enough nutritious food, your body doesn't have the fuel it needs to keep you going. Dehydration is particularly common in older adults, as the sense of thirst tends to diminish with age. Without enough water, your body struggles to perform basic functions, leading to fatigue. On the flip side, doing too much can also wear you out. Overexerting yourself, whether through physical activity or mental stress, can leave you feeling drained. Medications can play a role too. Many drugs used to treat conditions like high blood pressure, depression, or allergies have fatigue as a side effect. If you've recently started a new medication and are feeling more tired than usual, it's worth discussing with your doctor. Sometimes, simply adjusting the dosage or switching to a different drug can make a big difference. Fatigue is more than just an inconvenience. It's a warning sign that something is out of balance. If left untreated, it can lead to serious consequences. Fatigue increases the risk of falls, which are a leading cause of injury among older adults. It can also contribute to social isolation, as you may feel too tired to go out or spend time with loved ones. So, what should you do if you're experiencing fatigue? The first step is to talk to your doctor. They can help identify the underlying cause by asking about your symptoms, medical history, and lifestyle. Blood tests, imaging scans, or other diagnostic tools might be needed to pinpoint the problem. Once the cause is identified, your doctor can recommend a treatment plan. In the meantime, there are steps you can take to manage fatigue. Start by improving your diet. Focus on foods that are rich in vitamins, minerals, and protein, such as lean meats, fish, eggs, fruits, and vegetables. Stay hydrated by drinking plenty of water throughout the day. If you're struggling to eat or drink enough, try smaller, more frequent meals and keep a water bottle nearby as a reminder to sip. Physical activity can help too, even if it's just a short walk or some gentle stretching. Exercise increases blood flow, boosts energy levels, and improves mood, making it one of the best ways to combat fatigue. If you're new to exercise, start slow and gradually build up your endurance. If your fatigue is caused by a medical condition, treating the underlying issue is key. For example, anemia can be managed with iron supplements or dietary changes, while thyroid problems can be treated with medication. If depression or anxiety is contributing to your fatigue, therapy or medication might be necessary. Support from family, friends, or a counselor can make a big difference in helping you feel better. Remember, fatigue is not a normal part of aging. It's your body's way of telling you that something isn't right. By paying attention to this warning sign and taking action early, you can protect your health and improve your quality of life. Don't ignore persistent tiredness. Listen to your body, seek help, and take steps to regain your energy and vitality. If you're enjoying this video, don't forget to subscribe to this channel. By subscribing, you'll never miss out on important tips to live a healthier and happier life. Third sign: longer periods of rest and sleep. As we grow older, the way we sleep and rest changes naturally. However, for someone in their final year, a noticeable increase in sleep duration or longer periods of rest during the day could be a subtle but significant warning sign. It's not just about feeling tired, it's about the body signaling deeper issues that might need attention. Prolonged periods of sleep can occur for several reasons, including underlying medical conditions or the body's natural decline. Some common factors include heart health issues. The heart plays a crucial role in delivering oxygen and nutrients to the body. When it struggles, the body may conserve energy by inducing longer sleep cycles. Heart failure, in particular, can lead to persistent fatigue and extended rest periods. Also, conditions like dementia or Alzheimer's disease often bring changes in sleep patterns. Longer rest periods may be the brain's way of coping with its declining ability to regulate energy. Kidney disease, diabetes, or advanced cancer can drain the body's energy reserves, making prolonged rest a necessity rather than a choice. Moreover, emotional well-being plays a major role in physical health. Depression can manifest as excessive sleeping or a lack of motivation to stay awake. While rest is essential, excessive sleeping can create a cycle that worsens overall health. Spending long hours in bed reduces physical activity, leading to muscle atrophy. This can make simple daily tasks increasingly difficult. More time spent resting may mean less interaction with loved ones, which can lead to feelings of loneliness or depression. Prolonged lying down can cause pressure sores and hinder proper blood circulation, increasing the risk of blood clots. Understanding the underlying cause is crucial. If someone is sleeping much more than usual, a thorough medical evaluation is necessary. Blood tests, imaging scans, or even a sleep study can help identify any hidden issues. Encourage maintaining a regular sleep schedule. Limiting naps during the day and establishing a consistent bedtime can improve overall energy levels. Gentle exercises like walking, stretching, or even light yoga can promote better circulation and reduce the need for extended rest. A balanced diet rich in vitamins and minerals can improve energy levels. Foods high in iron, like spinach and beans, or those rich in omega-3 fatty acids, like fish, can boost stamina. If you're noticing these signs in yourself or a loved one, it's important not to dismiss them as normal aging. Paying attention and seeking early intervention can significantly improve quality of life. Don't forget to share this video if you've made it this far. Your support ensures that more families can gain access to this information. Let's make a difference together. Fourth sign: persistent or high levels of pain. Pain is a common but deeply distressing symptom for many elderly individuals nearing the final stages of life, particularly those with terminal illnesses. It serves as both a physical and emotional challenge, signaling that the body is struggling to maintain its normal functions. While pain is not exclusive to terminal conditions, the severity, frequency, and persistence of pain in elderly individuals can be a subtle yet significant warning sign that the end of life may be approaching. Why persistent pain occurs? One reason is underlying medical conditions. Chronic illnesses such as advanced cancer, heart disease, arthritis, or neurological disorders like Parkinson's disease can cause unbearable pain. In terminal cases, the disease often progresses to a point where it significantly impacts the body's nerves, bones, and organs, resulting in persistent discomfort. Over time, aging or illness may damage the nervous system, leading to conditions like neuropathy, where pain signals become constant and overwhelming. Terminally ill patients are particularly prone to this, as their bodies may no longer have the resources to repair damaged nerves. Pain can also stem from inflammation in organs like the liver or kidneys. As these vital organs begin to fail, toxins build up in the body, creating a cascade of physical discomfort that can be hard to manage. Pain is not purely physical. Emotional distress, fear, and anxiety often amplify the sensation of pain. Terminally ill individuals may feel trapped in a cycle where physical and emotional pain feed into one another. Persistent pain in terminally ill individuals is not just physically draining, it has a profound impact on their overall well-being. Constant pain makes it difficult to move or perform basic tasks, leading to muscle weakness and eventual dependency on caregivers. Pain often worsens at night, robbing individuals of restful sleep. This contributes to fatigue, irritability, and diminished immune function. Those suffering from pain may withdraw from social interactions, as even simple conversations or visits can feel overwhelming. Pain can lead to depression, hopelessness, and even thoughts of giving up. It's emotionally exhausting for both the individual and their loved ones. Now the question is, how to address persistent pain? Comprehensive pain, management, medications. Prescribed painkillers, including opioids like morphine or non-opioid medications, can help reduce discomfort. It's important to use these under strict medical supervision to avoid side effects or dependency. Topical treatments. Creams or patches containing lidocaine or capsaicin may provide localized pain relief. Specialized palliative care services focus on improving the quality of life for terminally ill individuals by addressing both physical and emotional pain. This includes medication, physical therapy, and emotional counseling. Gentle stretching, massages, or heat therapy can alleviate certain types of pain, particularly in the muscles and joints. Holistic approaches. Mindfulness and meditation. Practicing mindfulness or guided meditation can help individuals cope with pain by altering their perception of it. In some cases, alternative therapies like acupuncture have been shown to reduce chronic pain levels. Emotional support. A strong support system can make a significant difference. Engaging with loved ones or participating in counseling can reduce the emotional burden of pain, helping individuals feel more supported and less isolated. If persistent pain is affecting the quality of life for someone you care about, don't ignore it. Pain is not an inevitable part of aging, especially at such high levels. Seek immediate medical guidance to explore pain relief options and improve overall comfort. If you've faced similar challenges, share your story in the comments. Your experiences could guide and support others in this community. Moving on to final warning sign: shortness of breath. Shortness of breath, also known as dyspnea, is another subtle but significant sign that may indicate a person is nearing the final stages of their life. It's not just a result of aging, it can often signify underlying health issues such as heart failure, lung diseases, or even advanced cancer. This symptom can deeply impact daily activities, making simple tasks like walking across the room or climbing a single step feel exhausting. Why does it happen? Shortness of breath occurs when the body struggles to get enough oxygen. For elderly individuals, this could be due to a weakened heart that can no longer pump efficiently, fluid buildup in the lungs caused by heart failure, or diseases like chronic obstructive pulmonary disease. Even anxiety or emotional distress can exacerbate the feeling of breathlessness, creating a cycle where physical and mental health deteriorate simultaneously. Prolonged shortness of breath can lead to significant risks. The lack of oxygen can cause fatigue, confusion, and in severe cases, organ damage. For someone already in a fragile state, it's a clear warning sign that their body is struggling to maintain normal functions. Recognizing shortness of breath is crucial. Look for signs like labored breathing, frequent pauses to catch their breath, or changes in their skin color, such as a bluish tint around the lips or fingertips. The step you can take is to seek medical evaluation. Use supportive measures. Devices like oxygen tanks or CPAP machines can make breathing easier. Create a comfortable environment. Ensure proper ventilation in their living space and minimize activities that could cause exertion. Promote calmness. Anxiety often worsens shortness of breath. Techniques like deep breathing exercises or simply providing reassurance can help ease their discomfort. Shortness of breath can be terrifying, not just for the person experiencing it, but also for their loved ones. It's a sign that their body is fighting harder than it should to sustain life. By staying vigilant and compassionate, you can help ease their journey and ensure they are as comfortable as possible. If you or your loved one have faced similar struggles with breathlessness, share your experiences in the comments below. Your story might provide comfort and guidance to someone else in this community. As we grow older, the subtle signs of life's transitions often become more apparent. Recognizing these 5 signs: unexplained weight loss, persistent fatigue, longer periods of rest, unmanageable pain, and shortness of breath can help you or your loved ones navigate the challenges of aging with greater awareness and preparation. These warnings aren't just indicators of declining health. They are calls to action, encouraging us to seek better care, make meaningful changes, and cherish the time we have. It's important to remember that aging is not a defeat, but a natural process, one that requires understanding, patience, and a proactive approach. By being mindful of these signs, we can provide better support and ensure a more peaceful and dignified journey through life's later stages. If this video resonated with you, please take a moment to share it with others. It might be the lifeline someone else needs to care for their loved one. And in the comments, let us know what topics you'd like us to cover next or share your own experiences. Every story matters, and together we can create a community of understanding and support. Thank you for watching. Stay healthy, stay informed, and remember to make every moment count.